So again, I want to welcome everybody to another one of our town hall meetings, and back by popular demand is Dr. Harris Frankel. We'll get to him in just 1 second, but I want you to know that this is a webinar. It's a little different than our last one. So you are in listen only and view only mode. So we don't see you, but you can see us. And in order to ask questions, you can use the question or the chat area, and we will be able to ask those questions for you. But for today, we're going to go for about 45 minutes. We'll have Harris give us an update. Jon and I will also give an update on what's going on with the Federation. And then we're going to have Scott Litke pop in and tell us a little bit about the survivors, the Holocaust survivors. And if Chris Ulven is available, he'll give us an update on the home. And with that, I just want to thank Harris for coming back. We are clearly in another phase of the COVID-19 crisis. We noticed that states are starting to open up, and I think that might be a couple of questions for you later on. But I'm going to turn it over to you to kind of fill us in on what you are seeing and from a local level, and then we'll open up for questions.
Yeah, so just to give you some perspective real quick, 2.7 million cases worldwide, 192,000 deaths worldwide. 50% of deaths in Europe have been in long-term care facilities. So I think that speaks to the demographic of the most susceptible. In Nebraska, we have identified 2,124 cases as of this morning, 47 deaths. The majority of deaths have occurred in areas of recent outbreaks in Dakota County, Hall County, and Dawson County. So Dakota City, where there's a processing plant, Hall County, where there's a processing plant, and in Dawson County, where there's also a processing plant. These have become real hot zones, and quite frankly, are posing the greatest risk to the healthcare facilities in Omaha. Just to give you some perspective, Hall County, which is 1/10 the size of Douglas County, has twice as many cases. Hall County leads the state with 647 cases. Douglas County has 327 cases, followed by Dawson and Dakota counties at 256 and 168 cases respectively. Douglas County, the 348 cases, there have been 14 deaths. We're seeing a rather diverse population of affected individuals. There still is a preponderance of the elderly, but it's spanning all ethnicities, Hispanic, Asian, African American. So it does not take any single prisoner. It's really ambiguous as to who gets affected. Clearly, elderly individuals, those with underlying health conditions, remain the most at risk, and that's consistent with what we're seeing. Fortunately, in Omaha specifically, we have not seen the massive surge that we had initially predicted. And in fact, by all accounts, we would be approaching the peak of our surge early next week. And it would appear that we're not going to be anywhere near the levels of critically ill patients that we had predicted initially. And I think that's, that's simply a matter of when the modeling first began, we did not have good data. And to the extent that we have data today, it still is in large sense incomplete because the ability to successfully test people has fallen short of what most people had hoped. And that's less about the availability of test kits and more about the supplies necessary to process the tests. So nasopharyngeal swabs, reagents, et cetera, transport media. The supply chain for those items has been choked in large part because I think the various companies that have come out with the test kits were unable to scale, or at least their partners were unable to scale the supplies necessary to process all the tests in the time period that the tests were being requested. As you're all aware, if you listen to the news, more tests are becoming available, more tests are being done. Because of that, we're seeing more cases. As I said earlier, the biggest risk to the Omaha community healthcare delivery system as relates to any surge now has become the 5 outlying communities in central and northeast Nebraska, so Hall, Adams, Dawson, Madison, and Dakota counties, where there are packing plants. The other hotspots have been about a dozen nursing homes across the state where there have been some significant outbreaks. Fortunately, I'm not aware of, and Alan, you can correct me, I'm not aware of anybody at the Rose Blumkin home that has tested positive.
No, as of now, no, but we have Chris Ulvin coming on in a minute. Chris, do you want to, I don't know if you heard that question, but Harris just asked if we had anybody at the Blumkin home that's tested positive.
We do not have.
And have you had any healthcare workers who have tested positive or been symptomatic in quarantine?
No, we've had 2 that were tested. They were both negative.
Great. Well, I think that speaks to the good work that your people are doing, and they should really be commended for that, because first and foremost, the people on the front lines, their health and safety needs to remain top priority, as I know it is with all of you. And I think they need to be commended for demonstrating the courage to be prepared to deal with this in the event it presents itself, because it's no small task. So what I can tell you is that I think Omaha, Douglas County, Sarpy County in general has done a good job in following the governor's directed health measures and following the non-pharmaceutical interventions of social distancing, isolation, et cetera, that were set forth. And I think that is in large part why we haven't seen the number of cases here that we initially anticipated, notwithstanding some of the flawed data early on. But I think people really have done a good job. I am of the belief, as others are, that there will be a second wave. What that second wave really looks like, I honestly don't know, and I don't think anybody could in their right mind accurately predict what that could look like. In terms of having a vaccine readily available, the first clinical trial with humans was launched yesterday at Oxford University, and realistically, before we were to have an effective vaccine, we're probably still 12 months away from that, to be honest. The other therapies, interventional therapies that you've heard about, there's really 3 that top the list that I think warrant any discussion at this point. Not that I'll belabor the call with that, but it's really the hydroxychloroquine, the remdesivir, and then the plasma infusion with antibodies. The hydroxychloroquine studies, there's 2 major studies ongoing in the United States, and there's not yet been any preliminary data released from those as of this time. You've heard some anecdotal data from different individuals across the country, perhaps. And again, it is anecdotal, even though they may represent that there's large numbers of patients. Again, don't know the details of the patient selection criteria, don't know whether or not these patients have been double-blinded, don't know where in the course of these illnesses patients have been administered the drug, and don't know if those patients would have gotten well even without the drug. So there's a lot of questions that need to be answered. And I think that's why a good scientific study is so important. In terms of the remdesivir, the drug that originally came out for Ebola that is produced by Gilead, you heard yesterday that the trial in China was abandoned with unfavorable results. I had queried some of my colleagues here, and what I'm told is that they did not achieve the number of enrollees that they had hoped to. The results have been indeterminate. There are trials of remdesivir ongoing here in the United States. In fact, Dr. Andre Khalil, one of my colleagues here, is leading one of those arms in this region. And we should have some preliminary data available, I would think, within the next couple of weeks. So the trials here for remdesivir remain underway. They're ongoing, and hopefully there'll be good data that comes out of those as they're released. The plasma and the antibodies, again, early in their course of investigation. I don't have any comment about those currently. but certainly that remains another possible alternative to therapeutic intervention for this. Otherwise, we remain saddled with just best medical care that we can provide for these individuals. As I said, being in Omaha, I think we're all very lucky. We've got fantastic healthcare providers and facilities across the city, you can be very proud of your state university, because I think that we continue to lead in this area. Others do look to us. Our people take this very seriously. They're proud to be out in front and have demonstrated a lot of courage. And with that, let me stop. Although I do remember one question that was posed to me, is the response in New York, the difference between that and what we saw in maybe some of the other coastal cities on the West Coast, is that due to a different strain in the virus? Again, based upon conversations with my colleagues, no. The difference is probably multifactorial. And in fact, it's been suggested that the virus was actually making its way through New York as early as December. There are reports that they were seeing influenza-like illness that was somewhat atypical that they had not seen previously. And so I think the surge of New York City is a reflection of they were totally blindsided by this. And you take a population density and the fact that there were 300,000 Chinese nationals that had come back to New York City around the new year speaks to why they were hit so hard. Similarly, with some of these other metropolitan areas, New Orleans, Detroit, et cetera, where you've got high population density, high international travel, including Chinese nationals, et cetera, I think speaks to why some of these other cities were so more heavily affected than we've seen in other places. So with that, I'll stop. Whenever you want me to answer questions, Alan, I'm happy to stick around for a little bit. I've got to jump off at noon, but happy to do whatever you'd like.
Alan, you're muted.
I have a couple of questions already. This one's from Marvin Bittner. VA is testing all employees of its nursing home in Grand Island. With increased available testing and the risk of asymptomatic employees who could spread the virus, is this being considered? I think that might be for Chris, but I'll let either one of you answer that.
So I was just on a phone call with Nebraska Healthcare Association, Leading Age Nebraska, and Governor Ricketts, and at this point he is not in favor of testing all healthcare employees every shift or whatever. With about 1 million people in the Omaha Metro, and around the last I heard 325 cases, I think we've done a really good job in the Omaha area of containing this and listening to the advice. So,
thank you. Harris, you want to comment on that?
Yeah, I don't have any additional comments beyond what was already made. I've heard the same thing.
Okay, so that ties into the next question from Pam Monsky. Should we register with the Test Nebraska website? Harris?
You know, I think the governor has made a plea for people to register with that. It's a pretty comprehensive survey. I don't know a lot about it yet. I'm told that the data is it's an encrypted site, that the data is secure. You know, I think as much as anything, the state is trying to do as best job they can in understanding the epidemiology of the disease in Nebraska, the demographics of who's affected, et cetera, et cetera. So I think from a research perspective, those that want to participate, I think it's a good idea. Those who at some point want to be tested based upon the criteria that are set forth, it's certainly reasonable. And I think in response to the governor, by all accounts, as I understand it currently, I don't see a reason not to do it. And if somebody's interested, I would certainly support that.
Okay. Jon Meyers, do you have a question?
I'll just add to that. I'll just add that I complete the Test Nebraska survey this morning, and you know, pretty standard questions. Ask some health questions. Ask your height and weight. So you know that's revealing for some. Ask if you've been exposed or have shown any symptoms with it.
Great. Thank you, Steve. John?
Yeah, first comment is I also registered for it, and I would urge anybody to do so. Harris, my question is this. I don't know if I should ask it of you or of the media, but it seems to me that we keep giving everybody the wrong set of numbers for me. To keep telling me how many cases we have doesn't show how many new cases or how we're growing, and if it's growing exponentially, if it's growing linearly. And I know there are graphs and websites you can do to look at that. The one statistic I keep looking for and cannot find is the hospitalization rate. And I know they're talking about the phases of getting back to normal, including a hospitalization rate, yet through this entire ordeal, nobody, not the national news, not the local news, has been talking about the hospitalization rate or new hospitalizations. Can you comment on why?
You know, John, I don't have an answer for you. I mean, I can tell you that the hospitalization rate in general is not overwhelming, at least not in our locale. You know, what has been reported is what is on the state's dashboard are obviously number of cases, number of tests that have been done, which parenthetically, I think the number of tests being done, you know, it underestimates because we haven't been able to satisfy the number of individuals being tested that we would like. And so I think it underestimates what may be really out there in terms of disease, which if you then translate that to a number that's really important, which is the case fatality rate. So the number of people that are dying from this disease, I think we would find that the case fatality rate is probably significantly lower than what we had originally anticipated. And certainly some of our data currently, despite the lower testing numbers, would suggest that. That being said, the rate of hospitalization is really variable. If you look at a Hall County, where their positive rate of tests is upwards of 45% right now, you know, and their hospitalization rate has been greater out there than what it is here. So I don't know that it is necessarily a statistic that has a lot of value, save for the individual locale, because everybody is different.
Well, what I'd like to take it a step further. When I look at hospitalization rate, I also understand that when you look at, for example, I keep following all the flu statistics from a couple years ago. 2018, there were 240,000 hospitalizations. So it'd be interesting to know where we are. But I think you also have to, if you're going to do that, or if somebody's going to tally that, is hospitalization bed days. So I understand that you go in with the flu, you're out in 3 or 4 days. You go in with this, it could be 21 days.
Yeah, exactly. So here's what I can tell you right now is at our facility on the main campus, we're currently averaging probably somewhere between 30 and 40 COVID-related patients. I would say of that, maybe a third are positive. The other 2/3 are under investigation. Of those 30 to 40 patients, you know, we may have anywhere from 10 to 20% in the ICU. And so when you look at that relative to the patients being tested, it's still a relatively small number. And when you hear that the gating parameters that the governor has set forth in terms of as relates to reopening a business for elective procedures, and you've heard the threshold of 30% bed capacity, 30% ICU bed capacity, and 30% ventilator capacity, that looks very different depending upon the institution. You know, if you take a small institution like Nebraska Orthopedic Hospital, you know, where maybe you got 30 beds, you know, 30% are, you know, 9 beds vacant. You look at our facility, you're talking, you know, 150 bed vacancy. And so it's very different depending upon the institution when you start applying these numbers. And so what I can tell you is that, yeah, it's not the hospitalization rate. It's not part of the dashboard. It, quite frankly, is really not a number that we have discussed other than what are current occupancy numbers look like, but not as a factor of all those infected. So,
great. I've got several questions here from the viewers. Ellie Bat asks, would it be helpful for the governor to close non-essential businesses in the counties where the meatpacking plants are located, or is it that intervention now is too late to be helpful? And a follow-up to that, she asks, do you know what resources the governor's sending to the hotspots?
Yeah, I guess I would say this, that I think, you know, where directed health measures have been issued and of course across the entire state, these non-pharmaceutical interventions, you know, social distancing, washing your hands, you know, covering your mouth when you cough and sneeze, wearing a mask when you're out in public, when you're not able to social distance, if you happen to be in a grocery store or something like that. I think those are all very important things to follow. I think the governor has emphasized those. I would not, however, be willing to opine on what I think the governor should or shouldn't do. I think that it's clear that he's taken a position that he wasn't going to mandate closing of these packing facilities. I will say that there are teams that are actively working with the packing facilities, the processing facilities, getting into those communities to help with both the cultural and communication gaps that have been identified in helping the members of those communities better participate and follow the non-pharmaceutical interventions. So I would say at the present time, the governor is doing and following through on all the things that he has set forth and the things that he believes his office and the Department of DHS feel are necessary currently for the state.
Good. Here's one from Mike Siegel. For Harris, in your opinion, what does our government need to do so we can open up some of these small businesses? Is it testing and isolating? Is it a vaccine?
Well, I think if you could be king for a day and you had a magic wand, I think you'd want to know that you had an effective vaccine, because you could vaccinate millions and millions of people. And I think that would provide a sense of security far beyond anything else that we might do. But let me say this. I think the opening up of our country, by no means, even in the least affected municipalities, is not going to be a light switch. And so we've been using the analogy, this could be like a dimmer switch. Yeah. And that dimmer switch may go up and or down depending upon where we are in the longitudinal timeline of this over the next many months. And I think that for what it's worth, and I'm not picking sides here, but I think you've all heard the message, is that the federal government has set some parameters moving from phase 1 to phase 2 to phase 3. He's given the state governors some latitude to use discretion based upon their knowledge of what's happening on the ground. And I think we'll have to see how that plays out. My assumption is, however, that even if we said today, everybody go back to doing what you were doing on December 31 of 2019, it isn't going to look that way. I think there is still a tremendous amount of fear that will keep people from engaging the normal activities and utilizing the businesses that they customarily did prior to all of this. And I think until such time we quell that fear, which I think largely will be the result of having a safe and meaningful vaccine, not to mention maybe some of the other interventional therapies that in the event you do become ill that have great potential to help somebody to a speedier recovery. I think there's going to be a lot of fear that prevents people from really accessing society in the manner that we had previously been accustomed to.
Okay, I have a couple other questions here, and I know we have about 5 minutes left. I'm going to tie one in to the next one. In the paper today, the governor talked about allowing faith-based organizations to start opening up sometime in May. And then we have the mayor speaking today about opening up swimming pools. So that's a caveat to this one. So as we start to reopen society, what precautions should we take to prepare safeguard for a second wave?
Yeah, so I'm familiar with both of those statements, and I guess what I would say is that I know that both the governor's team and the mayor's team are working on developing a set of guidelines that might enable them to permit opening of these public places. I suspect, and I don't know this, but I suspect there will be some call for maintaining social distancing, at least in houses of worship, to the extent that can be done. But I guess I would save further comment until I know what their guidance is.
Okay. And then the next question is, I know that COVID is not a foodborne illness, but could there be any danger of contracting COVID through takeout food if hypothetically an ill worker coughed on the food after it is cooked and it is being placed in a container?
So what I will tell you is that and maybe this is one for Dr. Bintner, who, by the way, if you all don't know, Marvin is an infectious disease specialist himself with a high level of expertise, and somebody who I have the utmost respect for because he was one of my attending physicians when I was an intern back in 1986. So if Marvin's still on, maybe he could answer that question.
I'll see if he pops up. But that leads me, Steve, to a point that maybe we should invite Marvin to one of our town hall meetings.
Well, he's in, but
so Marvin
100%,
did reply. Let me see here. He says, take out food, very unlikely. Thank you, Marvin. In the 3 minutes that we have left, I'm going to see if the panelists have any questions for Harris. John doesn't have any more. Chris, any more? Steve?
Well, Harris, you've kind of touched on it to a certain extent, but as a federation where we have obviously facilities that membership is very interested in returning to if it's safe and welcoming. Just wondering what your take is on opening fitness centers and swimming pools and child development centers and that type of thing. Summer camps.
You know, as I said, there will be, I think I would be inclined to follow the guidance of both the state and local health departments as these are developed. And I anticipate that these guidelines will be developed in the very near term because, as you've heard, at least from the governor's office, and May 4th has kind of been a targeted date, so long as there's not been significant change of activity here on the ground locally to really begin to open things back up to some extent. So I would continue to look for those guidelines that come out of the state DHHS and also the Douglas County Health Department. I think that's where the best source of information will come from. I've got to be honest, I've been privileged to work with these people for a long time, but never as closely as I have the last 6 to 8 weeks, and I think they're doing yeoman's work. So stay tuned.
Harris, thank you very much for your time. There were quite a few people that just said great info, and thank you, Harris. So if you didn't see those comments, I just want to let you know that people are appreciative of your time for us. And Steve, thank you for inviting Harris back again.
Yeah, thanks for having me. Thanks for all you do, and Shabbat Shalom.
Shabbat Shalom.
Thanks, Harris.